But we can see visuals on our screen right now. You've got the Burman and Munjal duo who has emerged as the strongest winner of the bid for Fortis Healthcare. And just very shortly, we're going to be cutting down to their press conference. The heroes of the Fortis battle, no pun intended here.
Well, I mean, they've got it right. They were a late entrant. They came up with an offer. They came up with an offer which was a differentiated offer, and the board has decided to go ahead for them. I think what they are proposing, the simple deal, nothing changes for Fortis. We would be strategic investors. We have little bit of experience of running hospitals, and there would be a significant amount of cash infusion which we would do. So for the existing board, I guess this looks like a better deal. And why? Let's hear from both of them.
And all those who were involved in making this decision to give us the opportunity to get involved with what we believe is a first-class healthcare system. It is the second largest healthcare system in India, and as we are all aware, healthcare is an area of great concern for India, both in its ability to reach all the people and also the kind of quality that we have achieved in India. We think with the offer that both the Burmans and we bring to the table, this would be beneficial for all the stakeholders of Fortis, the patients, the doctors, the employees, both medical and non-medical staff, the community at large, and more than anything else, the shareholders, because we do believe this is a company with just the right touch of liquidity and improved governance can actually meet all of the needs of becoming a first-class institution. So I want to thank Anand and Mohit as our partners. The three of us have done a fair bit of work to get to this stage, and we do hope the shareholders will see merit in what we bring to the table, both through our experience, both in healthcare. Incidentally, both of us bring extensive experience in healthcare, and also in general management of building high quality, well-governed and highly profitable companies, businesses and institutions. Anand?
On that note, we'd also like to state very emphatically that we have extremely, once the shareholders give their approval and all the regulatory hurdles are crossed, we have very, very explicit plans for the first 30 days, for the first 100 days, and for the first 365 days of the company. Our plans are absolutely crystal clear, and we expect to implement these as soon as we get all the regulatory approvals and the approvals from the shareholders.
I do want to add here that we also want to acknowledge the other companies who had made the bids. These are outstanding, high-quality enterprises. We want to acknowledge these entities as good companies, and we believe our offer being the better one won out. But from the Fortis point of view, we do believe we bring to the table which nobody else did in this offering, and that gave us an edge to get to this place, even though in healthcare some of them do have and also appear to have larger experience than us.
So since you're saying that for the first 30 days, 100 days and the first 365 days, you guys have a clear laid out plan, a vision for Fortis Healthcare. What would that be, if you can share it with us?
We cannot share that right now. It would be inappropriate to do that.
So it's a bit early to share it publicly. It's obviously something which at the right time, at appropriate time, once all of the regulatory clearances are in place and we can play an active role, that's where I think as active responsible shareholders, that's the time I think we would be happy to share any plans.
By when do you expect the regulatory clearances and approvals to be done?
So in our case it's only two. There's a CCI clearance required and there's a shareholders approval that's required. It's just these two, and we do believe both of these should happen in a reasonably short period of time. One, because the company requires urgent liquidity and attention. So, and the shareholders are quite conscious of this. In fact, the shareholders are one who have pushed the company to make a quicker choice, to run a more transparent process, to make it more rigorous, And so we do believe the company, at the end of the day, did run a very rigorous process. It got some outstanding companies on the table to make offers. So the requirement of getting CCI clearance from our side would be, I presume, simpler than all the others, since ours is a Form 1 requirement for CCI, and the rest, as I said, is only shareholders' approval required.
Mr. Munjal, just one more question.
Based on the board as far as how members have dissented. So we wanted to understand, what are your thoughts at this point of time? Are you actually hopeful? Are you confident that the meeting that will happen on May 22nd will go through?
And just to add to that, what are the current risk factors that you see with respect to now this bid, and also the kind of corporate governance issues that have been raised several times over in Fortis?
So the opportunity in Fortis has come around mainly because of this, because this, as I said earlier, is really one of the best systems in the country, healthcare systems, and it has suffered over the last some months and years. And there are, in a very public way, there are inquiries going on. There is an SFIO inquiry going on. There is a SEBI question which is out there, and this is very public. So, which is what created the opportunity for somebody like us to come in and bring our quality of experience, our quality of governance, our quality of management, and our kind of connections to what we think would be useful to bring Fortis back to where it should be and build this into amongst the finest systems in the region.
But do you believe that the shareholders will see intrinsic value in your offer? And have you had any talks with the minority shareholders regarding this so far?
So we obviously believe that, otherwise we wouldn't be sitting here.
Exactly.
As you
no,
can
we are
imagine.
shareholders ourselves.
Yeah.
Okay.
Yeah.
And we are, by the way, exactly as Anand is saying, between us we already hold 3% shares of the company, but we hope to up that significantly through this process. And we do think the shareholders will both see reason and appreciate why this is being done and what it means both for the organization and for the shareholders themselves, both in the short term and in the long term, because both of us come from organizations which have outstanding record of value creation, wealth creation, communication, high quality work, not just in the companies but also with communities around the companies.
And corporate governance as well. Yes.
And we do think that's something which is both required in this entity, and which we believe the shareholders will see merit in.
Sir, after this investment, how do you see healthcare as a long-term business sector to invest in? Where do you see yourself in the healthcare sector?
So healthcare is, as I said earlier, one of the most critical sectors in any country, alongside education. So education and healthcare are two areas which are the basic social good that any country needs to provide, and in most countries governments take on the responsibility of doing this. But increasingly worldwide it's been found that the government systems have not been able to meet the full needs. So the private sector plays an active supplementary role, and in some countries the role is much larger, in some it's lesser. In India it's quite clear that the private sector plays an active and a very important role in providing healthcare. And of late there has also been a lot of pushback in terms of how patients have been treated sometimes and how pricing has been done. So we've had a fairly active period in the immediate past. So I do believe this needs to get resolved, and once we get over this, there is plenty of work to be done, and there is a lot of serious work to be done, both in terms of outreach programs, public health programs, high quality tertiary care, research and innovation in healthcare, to get to the kind of needs that we as a nation have, because we are a very diversified country. We are more diverse than most continents actually as a single nation. So our needs are right from the very basic to the very sophisticated, and we have to figure out a way as a nation, how do you address each one in the most appropriate and the best manner that you can do this at a cost which the consumer / patient can actually afford. So we do have some who can pay very high prices, can go overseas, can go to the best places. We need to have all of that available in India. So for this, our policy needs to both facilitate and actually encourage growth in the sector. That is important. And the community, the service providers, the pharma companies, the researchers, the policymakers and governments need to sit down and have a serious conversation about this to figure out how do you build a best-in-class system for a country as diverse and as large as ours.